Welcome. Buenas noches. Good evening. Thank you all for joining us this evening. I'm Dr. Minerva Romero Arenas. I'm an endocrine and general surgery at Weill Cornell Medicine. I'm also one of the founding members of the Latino Surgical Society. And on behalf of the founders, I want to give you a warm welcome and thank you for joining us today. The Latino Surgical Society was established to cultivate, nurture, and support the advancement of Latino surgeons, and today's event is in line with this mission. We would like to thank our institutional members who have supported LSS, but also the faculty and trainees at their institution. Our institutional members include the University of Washington at Seattle, the University of California, San Francisco, the University of Texas, Austin, Massachusetts General Hospital, the Morehouse School of Medicine, Oregon Health Sciences University, Harbor, UCLA Medical Center, Penn State Department of Surgery, and Houston Methodist Hospital. You can find more information about our institutional and individual membership plans on our website at the www.latinosurgicalsociety.org. Lastly, we want to thank all of you, our members, for supporting and believing in our organization. Today, it is my distinct pleasure to welcome our distinguished speaker, Dr. Analiz Rodriguez, for the 8th installment of our series. Dr. Rodriguez obtained her Bachelor of Arts in Chemistry from New College, Florida, the Honors College of the State University System of Florida. She then matriculated in the NIH-sponsored Medical Scientist Training Program at Case Western Reserve University at the ripe age of 19 years old and completed the MD PhD program in 6 years. Dr. Rodriguez completed her neurosurgery residency training at Wake Forest University Medical Center and was inducted into the Alpha Omega Alpha Honor Society. During her residency, she was awarded an American Association of Neurological Surgeons Neurosurgery Research Education Foundation Research Fellowship for her work in glioblastoma. She was also selected for a socioeconomic fellowship from the Council of State Neurological Surgeons, a Congress of Neurological Surgeons Leadership Fellow, and as a member at large of the Women in Neurosurgery Executive Committee. Dr. Rodriguez completed her Neurosurgical Oncology Fellowship at City of Hope National Medical Center, which specializes in immunotherapy trials. She's currently on the AANS and CNS tumors section and the Women in Neurosurgery Executive Committee and serves as the Secretary of the Communication and Education Committee of the CSNS. So, doctora, bienvenida.
Gracias.
It's a pleasure to welcome you. Why don't we start by asking you to share with us a little bit about your background. Tell us where you come from and both national, ethnic background and where you grew up.
Sure. So I was actually born in California. My dad is Dominican, my mom is Puerto Rican. And then I basically lived most of my life in Florida. So I lived in Florida from the age of like 8 on to college. So definitely spent most of my formative years in Florida.
And why did you choose a career in medicine?
So I had been exposed to medicine somewhat. I'm the first doctor in my family, so no one else was a doctor, but my mother always worked in healthcare. So I had some idea of what a doctor does. And when I was little, I just kind of said that I was going to be a doctor when I grew up. So I kind of have some pictures of me playing with like doctor sets, etc. But when I was in the 4th grade, I actually saw something on TV where they did a brain surgery on a little girl. And I thought, well, that is really cool. I want to do that. What type of doctor does that? So that's when I started saying I was going to be a neurosurgeon. And then I would say that wasn't entirely met with enthusiasm. In my house it was, but I would say outside my house, I think a lot of people just kind of laughed when I would tell them that I'm going to be a neurosurgeon. And then in high school, I got interested in research. And that's when I found out what an MD PhD was. So by the time I was in college, I kind of knew that I was going to do MD PhD and neurosurgery. And then when I went to medical school, I did a shadow with neurosurgeons. I think that's really important for going into surgical specialties. Like even if you feel it might be for you, it's definitely a good idea to shadow surgeons.
Yeah, I think that's really key. Can you share with us with your background? You said you don't really have other people in your family who are doctors. How did you get connected to be able to shadow a neurosurgeon specifically?
So I didn't get to shadow a neurosurgeon until I was in medical school. So I find, what's kind of funny to me is now I have a lot of friends who know me, and their child just gets to like come and spend a day with me in clinic. And I think that only certain people get access to that. And those are people who, your parents are doctors and they just happen to know a neurosurgeon. So that wasn't the case for me. I actually never rotated with a doctor or a surgeon until I was in medical school. So that's kind of, but I will say that one thing that I think is important, because surgery is so different than other specialties, and especially in regards to lifestyle and urgency and stress, that you really need to sort out if you're a surgeon or not. What's interesting is when I was in medical school, we had an opportunity to work as an organ preservation specialist. So some of us medical students that kind of had an inclination for surgery worked at the Cleveland Clinic and as an organ preservation specialist. So I did that early on, like during my PhD years. And that really gave me a sense that I love the OR, because we would get paged and have to fly out and get organs. And sometimes it would be 2 a.m, as anyone that does transplant knows. And so got to interact directly with transplant surgeons. And I think that was another formative experience.
For our audience, we do have a lot of folks in our audience who are in their pre-medical stages, or maybe even medical students who might be looking for something to do during their summer break or research. How do you get plugged in to be an organ preservation specialist?
I guess I had heard about it from other medical students, and I imagine that it's actually a real job, and some people do it for their career. But yes, I think it's possible you could probably do it during a gap year. And basically you work directly in the OR. You go on ambulances, you take flights, you pick up organs from various people, and then you transport them back. And then in the OR, you're actually perfusing the organs for the surgeons. So you get to watch surgery and just be a part of the OR directly. So I thought it was a really good experience. And anyone, to my knowledge, all the medical students that had that job, all of us became surgeons. Because again, if you're getting paged at 2 a.m, it will definitely separate the surgeons from the non-surgeons pretty quickly.
Yeah, that's definitely one way to get selected in or out for sure. And Dr. Valbuena will know very well what she's signing up for, because she is very interested in becoming a transplant surgeon. So I'm sure she appreciates hearing all about this. I wonder if you can share a little bit more about your educational journey. You said earlier that you had met maybe with not the most enthusiasm to your interest in neurosurgery. Tell us a little bit more about how you navigated that.
Yeah, I definitely think it's basically intersectionality at its best. So not many women are neurosurgeons. And then I identify as Afro-Latina. So I'm far from white passing. I obviously am racially Black. That brings its own nuances. The other thing that's very interesting is having a first and last name that is Spanish. So obviously, immediately, before someone meets me, they make a lot of assumptions. They make assumptions that I don't speak English, that I'm not American, even if I tell them I'm born in America. They confuse me with other people. They call me like Dr. Gonzalez, Dr. Lopez, Dr. Fernandez. It's really kind of interesting. So there's a lot of intersectionality, I think, in my personal story, because I have 3 things that I can't do anything about. And I don't think that's a negative. What you are met with is both implicit and explicit bias. So I would say pretty early on, when I was in middle school and high school, I got different responses to saying I'm a neurosurgeon. Some people were very supportive and some people just laughed out loud. So I would say, I'm not sure what other people's experiences are. I do say that when I was in medical school, I definitely, I don't think I told everyone. I think I waited to find out if the person was going to be an ally and supporter before I disclosed what my plans were, because I definitely got various comments about it.
Tell me a little bit more about that. How did you identify whether they would be an ally and supporter?
Yeah, I think it's basically if people treat you the same as others, if people recognize that you have good skills and then like recommend you for things. I think to me, the best mentors are people who say, approach you and say, I think you would be good at this. I think you should apply for this. People who encourage you. And so I think also kind of seeing how people interact with others gives you insight into how they may interact with you. And an example I typically use is, for me, if I pick up on bigotry in any way, like, for example, if someone says something that's homophobic, even though I may not be part of that community, I take it as a kind of sign that if you're homophobic, then perhaps you're not really open to other forms, other groups. And I kind of pay attention to that closely.
In the wake of the 2020 events and the deaths of George Floyd and the social justice equity movement, how have you found it to navigate some of these now sort of tough and difficult conversations that we're having to navigate in surgical workspaces where we really previously were not seeing much of this dialogue, and and to some degree in the medical sphere?
I definitely think there's been significant changes that are very subtle, and I can definitely say have changed even within the last 5 years, within the last 10 years. I think first and foremost, the thing I have noticed is people just talking about it. And the reason I think that is monumental is, for example, I think, most other people, I'll just say other, meaning if you're not the classic mode of cisgender, straight, Christian, married white male, that's like the typical person you may find in certain spheres of medicine. And so if you're other in any way, And that could be racial, ethnic, that could be you came from a poor background, you're not Christian, you're Muslim, all these versions of being other. Before, I feel like a lot of people would try to assimilate or not talk about how they're being, how they are being treated, and just kept that to themselves and didn't talk about racism or didn't talk about sexism and other things that you may encounter on a semi-daily basis. So I find that to be the most apparent change that I've noticed, that people are open to talking about it. Whether or not there's going to be significant change, I hope so. I think it's a hopeful time, but I do think time will tell, because change just takes a long time.
Yeah, and I certainly share that view, and like I mentioned, leading you a little bit maybe with this question, definitely a big change from even deaths that had occurred just a couple years before. Certainly these events are not new to our Black and Brown communities, and so I am hopeful that we will see change. Although I agree, it's going to be a long-term change. I'm going to bring us back to talking a little bit about mentorship and sponsorship. These are some of the buzzwords that we're hearing in education. Can you tell us who have been your most important mentors and sponsors, and how have they contributed to professional development?
Yeah, I guess I would kind of go through my timeline. Obviously, first and foremost, I would say my mother, who always believed in me when she believes in me more than I believe in myself, which is fascinating. And anytime I told her I wanted to do something, she would figure it out. Like, for example, we didn't have a lot of money growing up, but I would, by no means, I did not grow up poor. What I mean is just that we weren't affluent. And for example, I remember when I was little and I showed a proclivity towards science, and my mom got me into a science camp that they only took middle schoolers, but she's like, oh, my daughter's so smart, she should be in this science camp. And she figured it out and like got me in. So she always kind of found ways for me to be in like gifted classes or whatever, even though it was, maybe outside of our means, she would figure it out and help me. And that's continued to this day. And then in high school, my science teacher, I think had a significant impact on me. She kind of brought me into research and encouraged me to pursue MD PhD. And then during my MD PhD, I would say I got to meet a lot of people. First and foremost, I got to meet Dr. Blades, who was the fourth Black woman in the United States to be a neurosurgeon. She was a faculty member at my school. I got an opportunity to work with her. And then in residency, I had some great mentors that were neurosurgeons, and they were men, but they really propelled me and encouraged me and gave me opportunities. So definitely, I think those are the key people.
I think it's so interesting how much of an impact our parents can have on our early sort of development. And you mentioned that your mom was in healthcare. What did she do? Is that?
Yeah, I think there's like various jobs, from like at-home nursing to working for like the Woman Infant Children program, so the WIC program. And so I think these things kind of indirectly impacted me, because usually she worked with underserved communities, and I think that was really good to see.
Have you found many sponsors in your career?
You mean sponsors in terms of?
So I would say that our maybe a broad definition for sponsors would be like senior senior surgeons who are in a position where they can actually lift and pull you up professionally, but perhaps serve a little, you know, a little different role than a mentor who may be a little bit closer. Sometimes mentors and sponsors can be the same people, but a lot of times the sponsors are a lot higher and are in a position of significantly more power or have better means to help, I guess, sort of launch you into new spheres and spaces.
Yeah, I would say currently I definitely consider my chair to be a sponsor. My chair, we have 10 faculty, four of whom are women, and that's highly unusual that a neurosurgery department has 40% women. And I think he unknowingly is a sponsor. He just views people for who they are and not necessarily, you know, what sex they are. And then I would say in residency, I've met some people who have continued to help me. Dr. Germano, who is a woman neurosurgery surgeon in New York area, who's always helped me since I was a resident. She is much more senior than me. And then even Dr. Dempsey from University of Wisconsin has one of the nicest people who I've asked him for advice after a webinar, or I guess not a webinar, but like a session that he gave. And then he has always kept in touch with me. And if I ever need things, he has definitely continued to help me throughout my career. So there are various people like that, even more than that, honestly, it takes a village, but those are people that just come to mind right off the bat.
And I think that's so important. It's definitely something that we hear a lot. It's not, sponsors are not necessarily available to us. One of the things that I think I often find myself telling students and residents is that they're not always going to find concordant mentors or sponsors in terms of, you know, whichever hat you're wearing at the time, whether that's women or LGBTQ or your race, ethnicity, cultural, religious background. And so it is important to be able to identify mentors, allies, sponsors who are going to help propel your career and who are going to support your journey, because they're also great. And you know, and most of my mentors were men, and definitely not mostly, actually not any Latino men or women. And so I think that's a key point. Thank you for sharing that.
I think as we create these type of societies, there will probably be more people of various backgrounds in leadership roles. But I definitely think, you know, for example, you don't have to within your own department. So there was a period of time for half of my neurosurgery residency, I was the only woman in the department. So I was the only resident and the only faculty. And if when that happens, you can definitely feel like there's a microscope on you, because you're the only, like you can categorize, you know, being the only woman in an entire department. And I will say that there were people that sometimes, I think there's certain, I don't know how to explain it, but certain hurdles unique to being a woman surgeon. And I was able to, Dr. Hildreth, I remember, is a trauma surgeon. And she she doesn't even know this, but some of the conversations I had with her, which were really candid about unique things that you encounter as a woman that unfortunately I had no one in my department to talk to about because they were all men. So you definitely have to, you know, approach people. Don't be shy.
Yeah, definitely. We recently in general surgery, there has been a lot of attention around childbearing and complications. And this has been followed up with an announcement just in the last week by the American Board of Surgery, issuing additional weeks for maternity leave. What do you feel comfortable speaking to what that looks like for neurosurgery and what's the attention to that from women in neuroscience?
Yeah, I guess I will say, you know, when I was applying to neurosurgery, there were very few programs that had women. First of all, there were few programs that had women. There were even fewer programs that had women that had a child during training. And I would say, as I mentioned, for the first half of my residency, I was the only woman in my program amongst both residents and faculty. To kind of have a women's network, besides women in neurosurgery, I also participated in an Association of Women Surgeons, so AWS, which was really helpful. And I remember distinctly we had to write, we wrote things about like lifestyle, and we wanted to write a piece about pregnancy during training. And we were all sitting there and none of us had navigated that. So we were all like, oh yeah, we should talk about this. We're gonna have to look up papers because none of us are pregnant or plan to get pregnant during our training right now. So it was really interesting that we are women surgeons writing about pregnancy, and we're like, well, that's not really something that we've experienced. I think that's definitely changed. Like I can say now that I definitely know more women having children during training. I think every generation is getting better. Like if I talk to some female attendings when I was a resident, it was like an unspoken thing that you didn't have children during training, or it was highly, highly frowned upon. And now I think it's changing where I think women are having more children during training. And I think it's more embraced. But I also want to be honest. I do think that there are a lot of programs where I think it would still be frowned upon, and you probably wouldn't get accommodations for yourself. And what's so interesting is how you need women faculty to change. Like, for example, I know when I was a resident, at least among the general surgery department, some of the women faculty brought up breastfeeding policy during surgery. So not something you think about, but surgeries are really long, especially in neurosurgery, like 10 hours. Typically surgeons, we don't take breaks. You don't even take breaks to go to the bathroom. So what do you do when you need a pump and you literally will leak? Like, what do you do? So you can wear, I mean, now there's pumping devices that can, you can have attached to you, but there needs to be policies. So they actually did do a policy. And then the thought was, oh my goodness, we need to do one for the residents. Residents can get pregnant too. So I think as more women come into surgical fields, there will be more changes, but I think we have huge, huge steps to take. I don't have any children. I have friends who are surgeons that have children. And I would say there are just so many things that you don't even think about. Like my friend who needs to find a place to pump close to the OR, and that just doesn't exist. Or other things that we really need to make more policies about that. And I think specifically for pregnancy, because I feel parental leave is great, but there need to be policies for pregnancy specifically, because it just brings a lot of issues that you wouldn't even think about. And I think our residents need to be protected when they have training, and they shouldn't be penalized for doing one of the most important jobs in the world. You should not be penalized for it.
Thank you for sharing that perspective. I would say that one of the up and coming issues in family planning is definitely the issue of fertility preservation, and certainly for whole generations of women surgeons, assisted reproductive technology has definitely been a huge need. But I want to, again, I keep leading us a little bit away from our conversation in terms of your career. If you could share, if you feel comfortable, what has been your greatest obstacle in your career advancement?
I guess for me, it has been, that's a good point. I feel like I've I've navigated things pretty well, and I've been blessed to have really great mentors and other sponsors, mentors, whatever you want to say, along the way. I would say that maybe some of the biggest hurdles, I guess one is yourself, like your mental game. Just thinking about, you know, just kind of what I was talking about earlier, believing in yourself. I think actually getting in your own way can be, you know, trying to prevent self-sabotage and believing that you can accomplish your goals. I think that's first and foremost. And then I think other than that is something that I thankfully learned kind of early is staying away from haters. I don't know what other way to say it. That's how I say it. If I find someone has negative energy or seems to not be supportive of me, I tend to stay away and protect myself from them. And I think that has been wise.
I'm not sure that there is a better way to stay away from all the haters. So we will leave it at that.
Yeah, don't know how to say that.
If you could give yourself, your younger self, some advice, what would that advice be?
I think I would say I have always been obsessed with time and like timelines. I think only now that I'm giving myself more leeway of like letting life happen, because I am a crazy planner, type A personality, very highly goal oriented. And so allowing life to happen and not being so fixated on, you know, things have to happen a certain way. I think early on I was fixated on like, this is what I want, it has to happen exactly, but life just happens, and it may not happen the way you imagined, and kind of going with the flow.
Definitely, our career demands a lot of flexibility, not just from ourselves, but from others in our life.
Yeah, absolutely.
Tell me a little bit about your life outside the operating room. How have you managed the so-called work-life balance or work-life integration?
I guess I would say that I am still working on it, to be honest. I think a lot of people who I'm a surgeon scientist, so I also have an independent research lab. So I have more than one job, obviously being a surgeon first and foremost, but then I have a research lab. So I have to write grants. I have postdocs. I have like research technicians. I have to have grant money in order to pay these people. So that puts another level of pressure on you in different ways. I would say that giving yourself like breaks in terms of if you don't meet, you know, certain deadlines, or if you don't do something, it's okay. It's not like the world's going to cave in. And then also I really enjoy bringing levity into my life. And I think for me, that means doing yoga, and that means watching really dumb TV and listening to music and things like that. And buying clothes and whatever gives you joy, and finding things that relieve stress that are healthy. And definitely, for me, the other thing is my faith. So I do think that all these things have helped me.
In knowing that we want to keep this commercial free, but if you can just share with us that you have no disclosures about this, what is your favorite trash TV show?
Yeah, that's very good. Right now, it's Married at First Sight. I love that show. So it's a show where people, you know, get paired by psychologists and then meet the person and marry them that same day. So and then they follow them afterwards. So I think that show is great, and it's full of drama, and yeah, definitely gets your mind off of work.
And that's giving me palpitations just thinking about the notion of doing that, but definitely sometimes just being able to lose yourself in someone else's drama is definitely a good outlet. So um, tell me now that we are hearing about your own research lab and the different facets of your career, what do you hope to see for rising Latino, Hispanic students, Latinx students who are aspiring to become neurosurgeons?
Yeah, I think it's a really, I really feel like medicine is, even though it's slow, is starting to change. And I feel like the main thing is our population is changing. I mean, the Latino population is going to be the majority. So um, I think we have to serve that community. And I find that my patients really enjoy having concordance with their physician. And I don't think that's necessarily an absolute thing that you need to have. But I do feel that in order to serve certain people, the workforce needs to be diversified. And it just how you relate to others. I think the statistics are so poor right now in regards to Latinos in medicine. It's it's just, I don't even know. It just breaks my heart, honestly. And what can we do about it? I think this seminar is one thing, but beyond that, I definitely think, to me, when people talk about pipelines, I think you have to start very early, because to get into medical school is not easy. I know more and more medical schools are cropping up, but it's still extremely difficult. And if you come from various backgrounds, it's even more difficult, because you don't even know anyone and you don't know how to navigate the system. You have no idea. I find that people just do very naive things. Like, they can't afford to apply to a lot of schools. So they told me, like, I applied to 2 schools. And I'm like, wow, of course you're not going to get into medical school. You can't apply to 2 medical schools. That's crazy to me. But I do understand it, because when your parents can't contribute money, or no one told you that you should be applying to 50 medical schools, you just don't know. So I think bringing awareness of how to navigate the system, because it really is kind of, in a way, you have to have gamesmanship. You have to figure out how to play the game, and in order to get to where you need to be.
Yeah, and that certainly is something that we're seeing, that the socioeconomic impact of even applying to residency, especially back in the days when interviews were live and you had to travel across the country and and essentially take out a whole another set of student loans potentially just to fund that investment, so to speak, in your career by being able to travel. So it seems like those hoops continue, applying to residency, applying to fellowship. So I certainly I can appreciate and agree with all of the points that you made. I want to thank you for all of your honesty and your candor so far in sharing your perspective and your experiences with us. We invited some of our audience, we invited our audience to submit questions. And so we do have a couple of questions that have come through our Q&A. And the first question, Dr. Rodriguez, it's great to see Latino representation in neurosurgery. Can you speak a little bit more about what we could do to encourage more Latinos and Latinas and Latinx to pursue careers in neurosurgery specifically?
Yeah, I think it's something on a national level, in regards to the neurosurgery organizations are really trying to address. I feel like, to me, one of the things I noticed, at least in my own practice, is there's a significant amount of Spanish speaking Latinos that feel like their care is significantly delayed because they can't really relay their medical problems in the right way in the current system. And honestly, it just is a language barrier. And the other thing that I recently, I am going to be one of the physicians that partakes in a new program funded by Bristol Myers Squibb to try to get more diversity in clinical trials. So it really, it's going to take Latinos that are currently in the system to like start changing these things. But how to encourage more people, I think it's visibility is first and foremost. I think that a lot of people don't even know that there are Hispanics in the field, that they never even knew a Hispanic surgeon in their whole life, and they never even thought it was possible. So I think that's one thing, visibility. And then trying to get people early. I feel that, from the data that we know of, like you're already going to face a lot of things that other people aren't going to face. Like I talked to you guys about like your name. It's really, you're already starting, it's going to be harder. Like I'm being honest, it's going to be harder. So you need to have more support and be prepared and understand what is coming. And I think we definitely need to provide information earlier, because I think that may help with overcoming some of these hurdles.
And I think having some support, even if it's the support not specifically within neurosurgery, but making a plug here, I think part of what we hope to create within the Latino surgical societies to provide that network of colleagues across the country, who can definitely identify with some of those challenges and potentially help us help each other navigate those difficult situations. We have another question from the audience, and thank you, Juan Pablo Jardín, for submitting this question. Can you share, Dr. Rodriguez, any specific instances or examples where you have experienced any gender disparity or challenges in the operating room throughout your career?
Yeah, I can definitely share. I'd never have a problem with sharing anything, honestly. I feel like it might be helpful. I would say my first time that I felt, it was basically a joke that someone made when I was a medical student. So I mentioned I was an organ preservation specialist, and I was working with someone, a transplant fellow in the back table, and we were dissecting some tissue off of a kidney. So anyways, he had like he had spread some tissue, and I was supposed to cut between, and that's a very common thing, but I was having difficulty with the angle, and he was kind of like, oh, well, you can do it doggy style, and kind of winked at me. And I was like taken aback, because I was like, wow, that's like a sexual reference. And then I started, I didn't say anything. I just did, my job. And later I was like, talking about this with my mom. I was like, do you think he would have said that if I was a man? And my mom's like, absolutely not. No, he would not have said that if you were a man. So that was my first experience. I think, to me, instances of sexism I didn't experience until I got to medical school. I think I went through college without ever really experiencing overt sexism. And I feel like as soon as I started medical school, various things, I can like tell many, many stories, but you specifically asked about in the OR. So I think to me, what I think our culture and our society needs, most of the time, people think, they don't talk about things or they don't say anything is wrong unless it's like something physical. So if someone were to physically, try to touch you or do something, then people start making a stir, like, oh, well, that person tried to touch you. People don't understand how significant what you say and how you joke and how that can impact culture and how that can make women feel, and how inappropriate it is. So I think that, in the future, I think that maybe that occurs less and less, but it's definitely something that I think all forms of sexual harassment and sexism need to be addressed, even if it's a simple comment, because it creates a culture that is not inclusive.
Thank you for sharing that. And that's really, I think, helpful advice for our audience. I want to transition a little bit. We modeled these Inside the Operating Room series after the Inside the Actor Studio. So we're going to move on to our rapid fire questions. And you're supposed to essentially just answer the first thing that comes to mind so that we can get as candid of an answer as possible. So we're going to go through these in a little bit of a rapid sequence. Ready?
Sure.
Yeah. So what is your least favorite word?
Heteroscedasticity.
Well, we're going to have to type that out and look it up for the audience. What sound or noise do you love?
Birds.
What is, I train in McAllen. I'm sorry, I used to work in McAllen, Rio Grande Valley, and that's one of the birding capitals of the world. Bird sounds are one of my favorites. What is one of your distinctive operating room preferences?
Oh, not shaving the head at all. I prefer not. I prefer to preserve all hair.
Interesting. Do you have a favorite joke?
Not really. No.
Neurosurgeons don't make jokes?
Yeah, my jokes are really terrible, so I think I will refrain from sharing any jokes.
What's your favorite thing about the operating room?
I think my favorite thing about the operating room is how much concentration is required and how you can zone out. Like you're not aware. It's like an outer body experience. You have no idea what's going on or how many hours have passed. You're zoned in.
What is your least favorite thing about the operating room?
My least favorite thing about the operating room, I would say, is if things aren't in order. Like if, for example, like I have a different team or something's just not quite right. Like if my mojo gets thrown off.
I think a lot of us can appreciate that. Is there one thing that you do every day?
Yeah, I guess, well, I think besides like the typical things like eat breakfast and shower, I would say one thing that I try to do every day is take out time to pray and read Bible verses, which sounds crazy to some people, but I feel like it's my form of meditation. And I usually do it during lunch, that I just like think about something completely different that kind of grounds you.
I like that. That's really nice. If you had to, what profession other than being a neurosurgeon would you like to attempt?
So if I wasn't a doctor, because if I wasn't a neurosurgeon, I would be a thoracic surgeon or a trauma surgeon. So it's not very many options. But so if I couldn't be a surgeon, I wouldn't do medicine, to be honest. And I think the off the wall job that I would do is that I love history. So I think I would be like a college history professor. Like I think that would be what I would do if
Nice.
it wasn't medical or science.
What's your favorite, I don't want to say genre of history, but maybe era?
Yeah, so I'm a huge Alexander the Great fan, so I would probably do something related to that. Like I love like ancient battles and military things. So yeah, it would probably be related.
Very cool. What profession would you not like to do?
Uh, that's a good question. What would I not like to do? Um, hmm. I never even thought about this. Don't, I can't really, I don't know. Nothing is coming to mind, but I imagine that I probably wouldn't like any job that doesn't have significant autonomy. Like I hate being told what to do. So I think like an office job where I have a direct boss and someone tells me what to do every day, I think I would not like that.
Spoken like a true surgeon. What is the best gift that you have ever received?
And the best gift I've ever received is actually from a friend of mine who took a photo and then painted it and then framed it. So I thought it was amazing.
Wow. What was the what was the photo of? If
So she actually took a photo of like a mountain, and she like I really liked that photo, and she like turned it into a painting and then gave it to me. I was like, wow, that's really cool.
Oh, very cool. Okay, well, you've made it through the rapid fire, and I am going to once again thank you, Doctora Rodriguez, for joining us for our 8th installment of Inside the Operating Room. I want to also thank all of our participants who have tuned in this evening and those of you who are going to view this on our YouTube channel. If you are interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org. You can also find us on various social media channels using @Latinosurgery. And the recording for this event will be made available on our YouTube. Buenas noches a todos.